Welcome back for Chapter 12. We're going to cover tonight emergencies and medical. Now we're going to break and talk about Part 2. We're going to talk about medical and preparedness. And first thing we're going to talk about is seasickness. Boat motion and symptoms. A boat can have 6 different motions, 3 rotary motions, pitch, roll, and yaw, and 3 linear motions, surge, heave, and sway. These erratic motions confuse the brain's motion analyzer with signals arriving from the inner ear, the eyes, and the sensors in muscles and joints. In other words, you know and feel that the boat is moving, yet you sense the horizon is moving and not the boat. Your joints and muscles are busy trying to maintain the body's balance against the unpredictable movement of the vessel beneath you. These contradictory signals cause seasickness, particularly in individuals that are more prone to motion sickness of any kind. The symptoms of seasickness may appear in the following order: skin pallor, cold, sweating, headaches, malaise, dizziness, hyperventilation, nausea, and vomiting. Seasickness is debilitating to crew, and the products of seasickness can induce sickness in others. Over-the-counter medications. Anyone who has ever experienced motion sickness should prepare to take anti-seasickness pills 2 or 3 hours before departure so that the medication can take effect. A dermal patch placed behind the ear works quite well, but it too requires considerable time to act. A few motion sickness medications available without a prescription are, of course, Dramamine, Marazine, Bonine, and Motion Ease. They are effective as preventatives and work best if started the day before the voyage. Because their effect lasts only 10 to 12 hours, the dose must be taken repeatedly. All of these medications may cause drowsiness, dry mouth, or other side effects. Food and water contamination. Again, we're talking about cruising, long distance cruising. And food and water contamination can have dire consequences for the cruiser. While there can be several serious causes, usually dietary indiscretion, viral infections or infection from bacterially contaminated food are most common. Prevention of this illness caused by dietary indiscretion is simply to limit your food intake, and especially alcohol. Viral infections are passed from person to person, but you can minimize the problem by washing your hands frequently and always before contact with food. Controlling bacterial contamination is a problem in which cruising which increases cruises as one moves south. The higher temperatures and warmer climate can proliferate bacteria and spoil foodstuffs very quickly. Boiling water at least 20 minutes, washing all food thoroughly, and cooking most food will help to reduce contamination. Treatment of diarrhea must address 2 areas. You must reduce the frequency of the head calls and replace the loss of body fluids and minerals. There are over-the-counter medications that can help reduce the frequency and the accompanying cramps. Kaopectate, Pepto-Bismol, and Imodium AD are fairly common and available in most pharmacies. Or if you're watching the local commercials, the Pediacare, you may even want to buy your daughter a pony if you drink it. If a prescription drug is necessary for severe or persistent diarrhea, Lamodal may help. Contact a local physician to obtain a prescription. To avoid dehydration, drink water, apple juice, and clear soups to replace liquids and nutrients. Sunburn. Sunlight helps the body produce vitamin D and has been identified with other benefits to health. Excessive sunlight, however, can cause dry skin, premature wrinkles, and possibly skin cancer, the Surgeon General warns. On the water, you must take some precautions to prevent overexposure. Severe sunburn during the first days of a cruise can ruin the trip. Sunburn protection can be accomplished in several ways. Long-sleeved, loose shirts and long pants during the day provide the best protection if you must be in the sun during the height of the day. Especially designated materials especially designed materials for the tropics block out radiation but are still cool. A hat will prevent sunburn on the scalp as well as help shield the forehead, nose, and ears. A wide brim hat will also protect the neck and the face. Sunscreen lotions with maximum PABA, para-aminobenzoic acid, will protect the areas that are not covered. The recent concern regarding skin cancer has forced the market to provide sunscreens with remarkably high sun protection factors, or SPF, such as 30 and more. There are marginal gains in protection with lotions above the SPF of 15. Skin cancer is a result of cumulative exposure to sun. As we get older, we should be much more protective of our skin. Since the desired SPF varies with each individual, all whose crews should be encouraged to bring their own sunscreen. At sea, the sun is a danger to both the eyes and the skin. Be sure that all crew members wear sunglasses, preferably those that have polarizing lenses with UV ultraviolet protection. But remember, the polarizing lenses that we've talked may affect your ability to read the screens on our chart plotters. An excellent treatment for a sunburn is the use of an aloe ointment. Since the affected area needs moisture, pure aloe gel is a good addition to the ship's medical kit because of its soothing effects. However, any type of lotion containing aloe will work well. In the absence of aloe, one should apply cool, wet towels to the burned skin. Injuries. Wow. Bumps, bruises, fractures, cuts, and burns. All the operations are there. My personal recommendation is always wear shoes when you go on deck and keep your toes from finding the deck fittings that can cause you some real discomfort. Wounds. Providing the patient is breathing properly and maintaining an open airway. The first step in treating such injuries is to control bleeding. Use a sterile pad to apply a steady, firm pressure to the bleeding area. The wound should be raised above the heart if possible. It takes about 10 minutes for a satisfactory blood clot to form and stop the bleeding, so do not ease the pressure to see if the bleeding is stopped. Scalp wounds bleed more vigorously than comparable wounds in other areas of the body, so maintain pressure over these wounds for a longer period of time. If a bandage becomes saturated with blood, don't replace it. Apply another sterile dressing over it to prevent disrupting the clotting process that's already begun. Once the bleeding has been brought under control, clean the skin around the cut with a mild soap and water. Don't put antiseptic such as iodine on the wound. If you must clean out the laceration itself, use a hydrogen peroxide solution, but do not remove the clot. Finally, pull the edges of the cut together with butterfly bandages or with water-resistant adhesive surgical dressing tape, and cover the area with a sterile gauze dressing firmly secured in place by adhesive tape or a roller bandage gauze, that comes in a roll. Fractures. A fracture to the arm or leg must be immobilized by splinting. Using an airbag splint does this best. If an airbag splint is not available, place a generous amount of padding around the injured limb, using towels or items of clothing. Then secure the limb to a board or some other rigid support with elastic bandages. Using a pillow or a rolled-up magazine or newspaper as a splint, then holding it in place with an elastic bandage can easily immobilize fractures of the wrist or the ankle. Thermal burns. Thermal burns should be treated by immediately applying cold water. Salt water works fine for here. Do not put oil or margarine on a burn since it traps the heat in the skin by clogging the pores. Silvadene ointment applied to the burn greatly decreases pain and promotes healing. Cover the burn with non-adhering Telfa pads and wrap with a clean, dry bandage. Stings. If you're in the water, in the tropics, stings. You've got venomous marine animals about in tropical waters. But in summer, many of these animals find their way further north, making this an issue of concern for many cruisers. Jellyfish in particular follow the warm water north. The stinging cells on tentacles of jellyfish Nematocysts are essentially toxin carriers that attach to your skin. The toxin can be transmitted by jellyfish in the water or on the beach. The symptoms from these stings can range from redness to fevers and extreme pain. All depends on the amount of contact and by which creature. The Portuguese man-of-war has been known to cause severe pain requiring emergency treatment. I remember a story of a family where the young kids were walking along the beach and there had been a bunch of the small Portuguese man-of-war that had been washed up on the shore, and the kids were popping them in their bare feet, thinking it was a cool thing, and they wound up getting in some serious pain. The type and number of jellyfish and related marine invertebrates are great, and so cruisers should know first aid for these things. First, you should remove the tentacles that are holding the nematocysts. Credit card or other stiff card can be used to scrape the skin clean. Next, apply alcohol to neutralize any remaining toxins on the skin. For pain, take an over-the-counter painkiller to minimize any other effects. For more severe stings, seek medical aid as soon as possible. Shock. Shock is serious. Shock kills. Severe injury may be followed by shock, a dangerous condition where the victim's circulatory system basically collapses. Death will occur if it's not treated, even if the injuries sustained are not severe. Severe trauma, massive hemorrhage, dehydration, heart attack, drug reactions, poisoning, severe infections, or merely having witnessed someone else's injury can cause shock. The victim appears pale, breathes rapidly and shallowly, and has a weak pulse. He may even break into a cold sweat and even lose consciousness. Treat shock by placing the person in a reclining position and elevating the feet to promote circulation unless there's a head injuries involved. Cover the victim with blankets to maintain but not to increase body temperature. Have the victim take frequent sips of liquid, but do not give them any alcoholic beverages. Never try to give fluids orally to a person who's unconscious. Try to keep the victim alert, talk to him in an effort to calm him down, reassure him everything will be all right. Ask questions, what's your name, who's the president? If the victim goes more deeply into shock, he will become increasingly apathetic and eventually lose consciousness and die. It is imperative that medical help be sought as soon as possible. Hyperthermia, overheating of the body. Heat cramps, heat exhaustion. Heat cramps are painful contractions of the long muscles, such as those in the legs and the abdomen, resulting in the legs being drawn up and the body bent forward at the waist. Heat cramps are usually caused by salt loss and can occur alone or with heat exhaustion. Victims shall cease physical activity, retire to a shaded part of the boat, and drink lots of fluids. Treatment for the cramp requires a firm but gentle massaging downward along the affected muscles. Heat exhaustion is an incapacitating condition brought on by severe loss of fluids and inadequate intake of water. It can result from exposure to bright sunshine and overheating yourself with physical exertion in a hot place. Tasks such as changing a sail, getting a heavy anchor aboard, or changing a water pump in a hot engine room may bring about the condition. A victim of heat exhaustion experiences profuse sweating, pale skin that is clammy, nausea, dizziness, rapid pulse and breathing, headache, and muscle cramps. The victim should lie down in a cool location and drink large amounts of cool water, fruit juices, or sports drinks. Do not give the victim salt tablets. To treat, apply cool, wet cloths to the victim and loosen clothing to allow the heat to escape. Barring complications, immediate recovery from heat exhaustion may take 5 to 7 hours, while full recovery can take several days. The crew member suffering from heat exhaustion should be immediately treated, as this condition may rapidly develop into heat stroke.
That sounds bad.
Heat stroke, also called sunstroke, is a life-threatening medical emergency caused by excessive heat accompanied by a breakdown of the body's sweating ability. Heat stroke develops because the body cannot dissipate heat faster than it is being received externally. If the victim can no longer perspire, heat cannot be released from the body. Sweating normally is a protective mechanism that cools the overly heated body. However, in this instance, sweating fails to occur. Early symptoms of heat stroke include visual disturbances, headache, nausea, and vomiting. Additional symptoms include rapid respiration, rapid pounding pulse, weakness, and muscular flaccidity. As the condition progresses, the victim becomes delirious and eventually lapses into a coma. Body temperature is high, perhaps 105 or more. The best treatment for heat stroke is to cool the victim as quickly as possible, then seek medical help. Hypothermia. The hypothermia basically is equal to low body temperature. Describes those situations when the human body is too cool. When body temperatures fall 3 to 4 degrees below the normal of 98.6 degrees Fahrenheit, hypothermia occurs. The danger of hypothermia on a cruise can arise when a person overboard in cold water. Once the person is aboard, it is important to get him into dry, warm clothes as soon as possible. In the absence of a thermometer, an essential item for the medical kit, hypothermia should be a suspect if the victim has cold hands and feet and a cold abdomen. Symptoms include mental confusion, drowsiness, and slurred speech. If not treated, the victim may then experience unconsciousness, breathing that is slow and weak, and a slow heartbeat. To treat hypothermia, start a procedure for gradual warming and then call for medical help. The body loses most heat from the head, spine, and genitals. So the head should be wrapped and the body should be flat against a blanket or a warm surface. In addition to immersion in very cold water, hypothermia can also be caused by prolonged physical exertion in cold, windy weather. The elderly and small children are susceptible to hypothermia in less extreme circumstances. Hypothermia that occurs from exposure to cold weather comes gradually, but because water conducts heat 25 times faster than air, hypothermia occurs more quickly in the water. This rapid heat loss can occur in as little as 10 to 15 minutes. CPR and First Aid. Everyone, it goes without saying, everybody ought to have a current CPR class that they've taken. CPR is a life-saving technique which may save you with someone you love. If someone's heart is stopped as a result of a heart attack or drowning, the American Heart Association and the American Red Cross recommend that the untrained person begin chest compressions immediately. Do not be concerned for rescue breathing mouth to mouth. It is better to attempt to restore the heartbeat as soon as possible than to do nothing. First aid kits are an important piece of equipment for every boat, yet the size of the kit can vary greatly between boats. In other words, you should create medical kits that meet the special needs of the areas you are cruising in your crew. For example, those who cruise predominantly on rivers and find that the most common hazard is cutting one's feet on glass, sharp sticks, and rocks on the river bottom while waiting or launching the boat will want a kit that contains a large variety of bandages and antiseptic. The farther from shore you venture, the more items you should carry in your kit.